Dr. Tariq Fakhouri, Mohs surgeon and dermatologist with skin cancer specialists in Houston, Texas. We started coming with the plastic surgery team to the Guerrero clinic in 2019, and we came back again in 2022. We joined the plastic surgeons in their medical mission trip, and our role is to provide skin cancer care using the Mohs surgery technique. And we work complementary to their work, and hand in hand we're able to provide excellent outcomes for patients who don't otherwise have access to care. We really enjoy bringing our team. We think it's a very valuable and rewarding experience. We have the opportunity to take care of patients who have challenging skin cancers in difficult locations. And we're also able to learn a lot, collaborate with our American plastic surgeons as well as our Mexican counterparts. We are really blessed to have a great collegiate atmosphere and the ability to coordinate care locally and internationally. So as the patients come in, we evaluate them, we determine what they have, what they need, and if we need to do a procedure, if they have a suspicious skin lesion, then we'll remove it.
So I'm checking patients in and out of our system right now. And this is my high-tech filing system. Back to paper. Hi, my name is Huda Sana. I'm the director of the Sana Foundation. I actually never thought I would start a foundation, but we started doing some great work here at Guerrero Clinic, curing skin cancers, doing lots of different dermatology work, and it just kind of turned into a foundation now. My main role is getting everything coordinated, making sure that I'm coordinating with everyone here on our Mexico team, and that everything runs smoothly for the whole team.
I think the right thing to do is to biopsy a couple of these. Yeah, definitely the lip looks concerning for squamous cell carcinoma, and in front of the ear, this is pretty classic for an infiltrative BCC, so that could end up being a pretty tricky case. And there's a nodular basal cell carcinoma right in front of it, so these are probably all connected. This will be a longer case. It'll take multiple stages, so it'd be something we'd want to start in the morning.
Tu cuello, todo su cuerpo. Es muy importante que quitamos esta área ahorita, ¿ok? ¿Puedes venir mañana? ¿Sí?
Voy a pensar.
Okay. He's scared of he's scared of the surgery. He's scared of doing it. I told him
It's easy.
es muy fácil. Es algo muy fácil. Que podemos hacer todo aquí.
Yo voy a hablar con ella y yo le hablé Juan, es mi vecino.
Okay. Okay. He wants to talk to his wife, and then he's gonna talk to his neighbor, and they're gonna come.
We could start the case now, but with it being two locations that look more extensive, I want to make sure we have the time to remove the cancer appropriately. And we're not as fast in the lab when we're down here versus when we're back in the States, and that's just, that's just the way
I
it
told
is.
him there was worse and I have to go to treatment. I lost my hair, and then he started like, oh, okay, well, can I come tomorrow? I said, yeah, you should go tomorrow. He said, because your wife needs you, like my husband needs me. No, pues lléveselo, pero se lo trae mañana.
Okay.
Ajá. Para que vean que ya está registrado.
The skin lesion here, she was born with it doesn't hurt.
Yeah. Let's get a measurement, because I think at that size that it is, I think we probably want to remove it, because as she grows up, especially in this high altitude, strong near the equator, she's going to be at risk of developing a skin cancer in that. So when we have a congenital nevus that's over 2 centimeters and especially over 5 centimeters, that's when you have a higher risk of developing a melanoma later. So in the US, if we were able to kind of track this person more closely, we'd probably just opt to follow it. But here, I would recommend doing a small procedure to remove it for her. Oh, this one might already be open. Yeah, and she's 7, so maybe 10. 7 to 9, so maybe go 9. Does this come down?
Uh-huh.
How do you feel? She should feel some touching, but does it feel sharp or painful?
¿Te duele? No, ¿verdad? No, she doesn't feel anything.
Tension here. We do have some formalin bottles in there. So when we finish the case, we can put this and we'll take it back to the U.S. to analyze it.
For that part of the suture, in home, do you use the sutures or do you use the glue? What I call the glue. But I
You
don't-
could use glue, but I find sutures heal better.
Oh, okay.
Yeah, so that's why we use sutures. Can you let them know we gave her some medicine to make her sleepy, so she just needs to take it easy for another hour or so. Like, don't try to ride a bicycle or anything like that.
Le dieron medicina para que se durmiera, entonces alrededor de una hora que no haga nada, que se esté tranquila porque va a andar así toda mareada como drogada.
I just roomed the patient. I don't speak Spanish that well, so I'm just trying to get her in basic kind of communication just to show me where the spot is so that I can go report to doc, and then later Omar, whenever he's finished in the other room, he's gonna come in, get some translation, get some history of the present illness, how long it's been there, if it hurts, those kinds of questions that he needs to be asking.
Yes.
Can you close your eyes? Can you tell her that I'm going to talk to Dr. Fakhouri about whether he wants to do something about this or not?
Okay.
You know, it looks okay, especially since she's had it all her life, but she also looks like she's trying to squeeze it.
Okay.
Y estás rascando or echando presión, ¿no? So yeah, it kind of hurts her a little bit. Okay, vamos a hablar con el doctor si es algo que podemos quitar, okay? Sí.
Yeah, I agree. I don't like how much telangiectasia. That could be a function of sun damage, but it doesn't really look consistent with the rest and the fact that it's causing pain for her. I think it's probably a wise idea to just do a little excisional biopsy. The shave is not going to do great here. We could do a little excisional biopsy with a 5 monochrome and a 6 proline.
Her mole she's had all her life, and it looks okay, but it has a few signs of like being suspicious. Since she can't come back, the best thing to do is kind of cut it out and send it for a biopsy, just to make sure that there's nothing wrong with it.
While we try to prioritize things that are life-threatening or more of a medical risk, we still also are here to help with quality of life improvement. And if we can do that and allow somebody to feel better and happier about their skin, then we're pleased to do that as well. So this patient is from a local farming community and has a basal cell carcinoma in front of the right ear and a squamous cell carcinoma in the left upper lip. So we're going to do the Mohs technique to remove both of these tumors today. As I'm incising this, I like what I'm seeing here. It looks like normal tissue. Concern is always in the preauricular area that you could have a very deep tumor, and we don't know that until we analyze it microscopically, but at this point just my initial impressions are positive that we may be under it with the first stage, and that would be great. Document, I'm going to relax this tissue, get it to the lab so we can start the freezing process. By inking in 3 different quadrants, we are very easily able to determine under the microscope which area has tumor in it. The yellow we put at 9 o'clock, the red we put at 3 o'clock, and the blue at 6 o'clock.
Right now I'm embedding the tissue so I can freeze it. So I want to lay it completely flat. That way when I start cutting it, it's a full margin of what we took out. So seeing the epidermis all the way around from 12, 6, 3, 9. That way we can indicate if there's more cancer, where is this cancer going. So we're gonna let that freeze for a bit. So once it freezes, then I can start cutting it and start picking up the tissue and
So right now we have our first slides coming up on the first of the 2 tumors for this patient. We're doing our staining protocol. It's a little old school, doing it by hand, 1 slide at a time. We don't have an auto stainer set up here like we would back home in the United States, but this works just as well. Just requires a little bit of patience. So we dip it through our H&E stain, and once we're finished, we'll cover slip it here and analyze it under our microscope. Our next patient is from a local Mennonite farming community, and he has some long-standing hypertrophic and keloidal burn scars, which are causing him a lot of pain and discomfort and affecting his work and his daily activities. We're going to do some intralesional Kenalog injections to help calm this down, provide some at least temporary relief, recognizing that it's not a long-term cure, but it is something we can do that's going to provide some relief and help him get back to a lot of his daily activities. Ideally, in the future, we'll have some laser-based modalities such as CO2 laser, and that would allow us to provide some more long-standing relief for these patients who are suffering.
So this is the medication that we're going to inject into the scars to kind of settle them and to soften them and also reduce the inflammation that's causing the itching. So he has quite a bit, so we're focusing on the most itchy areas, the most symptomatic areas, and then for the rest of the areas I'm also prescribing over a topical steroid to help him kind of like as needed so he doesn't scratch those areas. Can you ask him how do you get burned?
¿Cómo se quemó, señor?
Con ácido sulfúrico.
Sulfuric acid.
Was that at work?
Working or?
Trabajando.
Sí, cuando trabajé me lo quiero echar en un tanque de 1000 litros con un bote de 50 y me cayó y se me está echando encima.
Okay, so he was trying to transfer the acid from one container to the other one, and then it spilled all over him.
So this patient, when we checked his slides after the first stage, was positive for infiltrative basal cell carcinoma around the 6 o'clock to 12 o'clock edge, as well as in the deep margin. So now we have a squamous cell carcinoma on the left cutaneous lip, and you can see that it's crossing from the vermilion lip onto the cutaneous lip. We've highlighted the vermilion border here. That's our linear line. And what we want to do is remove the tumor, obviously analyze it microscopically, but once it's clear, the reconstructive goal is to make sure this vermilion border lines back up appropriately. During the stage, we noticed a little bit of a unique anatomical variant in this patient. His superior labial artery, instead of traveling horizontally across the upper cutaneous lip, appeared to be having a branch that was a bit vertical. And so we're going to have to factor that in as we do our repair to ensure that we don't compromise blood flow to his lip. Well, looks like he's had some trauma to this area, whether it was a prior surgery or just trauma from daily life.
Wonderful.
That was a fun case. It should heal nicely. Thankfully, he's got some good blood flow, and I expect this to heal really well. We'll see. It's going to be important that he takes good care of it. It's going to be tough with his line of work, but we'll give him some instructions. We'll give him some antibiotics to take. Let me sit down.
Un momento, okay?
Okay.
Medicina. Para doler.
Okay.
I'm proud of him for coming
Oh,
back.
yes, me too. Que estamos muy orgullosos todos de que haya regresado.
Queda mucho usted.
I love
Okay, bye. Hey, Yana. Bye.
My name is Vincent Pham. I work for Dr. Fakhouri, a skin cancer specialist. I'm a surgical assistant for him, and I recently came to this mission trip in Guerrero, Mexico. I wanted to come here to help out the locals, of course. I felt like this was a good opportunity for me to kind of give back to somebody. I feel like in just the field of medicine, you really have that opportunity to impact lives, and that's what I was really looking for. One of the most meaningful experiences for me during this whole trip was after we did a lip patient and his family came and they thanked us, and we shook all of their hands. It's a really meaningful moment for me, and I hope to carry that on into the future and into my career.
Hi, my name is Anita Juarez, and I'm a physician assistant. I work with Dr. Fakhouri at Skin Cancer Specialist. I came on this mission trip because I've heard about all the great things that Dr. Fakhouri did last time, and to help an underserved community. On this mission trip, we saw a lot of different skin diseases and skin conditions. We saw a burn victim that needed appropriate care, and we were able to stabilize him and get him the care that he needed. We also saw a lot of skin cancers that were there for a while and had become pretty extensive, and we were able to cure them and have them become cancer-free. So it was a very fulfilling trip. I not only helped a lot of people, but I felt like I grew a lot myself. I was able to do things that I doubted myself in my abilities, and I was able to get mentored and guided and accomplish those things. So it was very fulfilling. I feel like I've grown as a provider as well. So I'm very grateful that this community had us here and that I had this opportunity.
My name is Omar Soto. I'm a surgical assistant with Dr. Fakhouri for Skin Cancer Specialist. I'm here today in Mexico helping out as a surgical assistant, but also doing histology tech stuff as well. I came on this trip because I have a passion to help people. I am a pre-medical student. I do plan on being a doctor myself. And just being here and seeing these people and the way that they live and how they have so much gratitude for healthcare means a lot to me. And I am Mexican. I am proud to be Mexican, so it feels good to be here in the motherland helping my people, and this is what I love to do.